Good morning and thank you for joining us. I hope everyone had a nice weekend and were able to get out and enjoy a little bit of the fantastic weather that we've had here. I'd like to start off with a brief overview of our testing situation and our cases here in Lane County. To date, we have 48 positive cases coming from Lane County. Of those cases, it took around 2,159 tests to identify those. You might notice on our website that we have a number that says 49 positive cases. That's actually a mistake. The state reported one of the Multnomah County cases as a Lane County case. So we have caught that mistake, reported it back to the state, and then have made that change on our website. So it may take a little bit to update, but just wanted to clarify that for folks at home. Of those cases, we have one individual who remains hospitalized. The rest of our cases are recovering at home. We have 19 individuals who have made a complete recovery. And again, recovery means 72 hours of having no fever or a cough without the help of medication. And we still have only one fatality as a result of COVID-19. We've been looking at, well, I'll get into our demographics a little bit after I talk about some of the two cases that were identified over the weekend. We were at 46 on Friday. We moved up to 48. So our 45th case was a male in his 20s. He is from the Eugene-Springfield area and is at home recovering. We have a female in her 50s, also from the Eugene-Springfield area, who has a designated epidemiological link to her employer. So we are working with that employer to help mitigate the spread of COVID. This is an employer who remains open, so we are doing our best to make sure that we have contact with everyone at that facility. And because it is a relatively small facility and they don't have a lot of public contact, we are confident that we can make that without having to make the actual employer known at this time. I'd like to talk a little bit about our demographics that we're seeing. We've got a lot of question about knowing a few different data points about the cases and trying to make some inferences based on what we're seeing. I'd like to throw out there, though, that the number of cases being at 48 really is limited. And so generally what we want to do is we want to see hundreds, if not thousands, to be able to correctly and accurately start to make some assumptions about what's going on. However, even with this limited number of cases, we are able to see some disproportionate representation, and that is primarily within our Latinx population. So you've probably heard some different numbers being floated around about what that number actually is. After identifying some problems with the way in which ethnicity is reported, we were able to sort of scrub our data. That requires some additional phone calls, talking through different data points with some of our cases to get down to that real accurate number. And we believe what we're seeing right now is around 20.8 or 21% roughly of our cases are Latinx as in terms of their ethnicity. So with around 9.3% of Lane County being a Latinx, that is a disproportionate number of individuals represented within that case count. And that's certainly something that we are taking a concerted approach on, making sure that we have materials available, communication materials to that population, working with local service providers to make sure that they have the resources needed right now, healthcare and otherwise, and making sure that we have those touch points. So certainly something that we are aware of and something that we're working on. Of those cases as well, around a 50-50 split between female and male, and nearly half of our cases, by far the majority, are within the 40 to 60-year-old age range. So there definitely seems to be a disproportionate number of people that are in that 40 to 60-year-old age range as well. I will now let Dr. Patrick Ledke, our Senior Public Health Officer, talk a little bit about testing, and he will also take any questions from members of the media. Initially, any ones that he doesn't take, I'll be happy to answer.
Thank you, Jason. Happy to talk today about some testing issues and concerns and actually some good news. I think the really impressive news is that for the first time, we've had local testing volumes jump up to the top 4 slots in our community. Longtime listeners to these messages have known that we have 4 main commercial laboratories that serve our community. Quest, LabCorp, Interpath, and Legacy. Those are the 4 laboratories. And they've provided the bulk of testing in addition to the state public health laboratory. And all of a sudden, in the last couple of weeks, Peace Health hospitals and laboratories have slowly increased their testing, and they've now moved into the number 2 position of testing, which is amazing and a wonderful addition to our community. We also have the announcement you probably remember last week with the collaboration between the university and Mackenzie to add testing at Mackenzie Hospital. And they're going to be ramping up their numbers as of today. So hopefully an additional 100 tests per day done in that area. So we're getting local testing capacity, which of course a few weeks ago we had none. So it's very nice to see that. I also want to mention a bit about these serological tests, those so-called antibody tests. So up until now, the tests that we've had done actually identify pieces of the virus inside of somebody's body. Those are those PCR tests. These serological tests are the other side of that coin. What they identify is the body's response to the virus. So these serological tests identify antibodies that a person makes when they get infected. So both of the tests have value. We use them for a variety of infections, and I suspect some of you viewers today have had these tests done, whether they're the tests that identify the virus or the bacteria, or they're a test that pick up the antibodies that you've made. Interestingly, we now have a couple FDA-approved tests for antibodies or for serological testing. And we have hope that there'll be uses for those tests, but we also know that there are limitations. So when you think about your testing as just an individual person, if a test is, say, 97% specific, that means it picks up 97 times out of 100 the actual virus or bacteria that we want it to pick up. So it's only wrong 3 times. So for an individual person, that's pretty darn good. I think most of us would have loved to have gotten 97s on our papers in elementary school or college. But if you look at it from a population standpoint, we're in a county of approaching 400,000 people. If we get 3% of the tests wrong, that's quite a few people. So we really have to be careful as we roll out these tests across the population. So we're looking at that closely. We're working with the Oregon Health Authority, our state, and also with the CDC to look at specific serological or antibody type of testing paradigms that would be of value in our community. We're not fully there yet. We don't fully know what it is we feel is of most benefit, but we're looking at it pretty deeply. So I'm going to stop with that. Happy to take any questions.
We have one question from Emma at KEZI. Did the 2 cases this weekend have underlying medical conditions?
So I'm going to let Jason take that one.
Perhaps by the next outbreak, we will have a more efficient way to cleanse our podium. So Emma's question was, were either the cases that happened over the weekend or the announcement that happened over the weekend, did they have underlying health conditions? I'm not aware of any underlying health conditions of those 2 cases. However, Emma, we are putting together a report on that very data point so that we can show people sort of the underlying health conditions as compared to how the disease affected individuals. So looking at their hospitalization percentage of individuals with underlying conditions, how long they stayed in the hospital, how long their illness lasted amongst those individuals who have recovered, and some really interesting data that I hope will help our community understand this disease a little bit better.
Question from Bob at KZI. How did social distancing go this weekend? Was there any enforcement of the executive order necessary?
So the question is from Bob at KZI. How did social distancing go over the weekend? So I think Bob knows this, and for the benefit of our community, we can't be everywhere at all times. So what we look at is a few different indicators. And on those indicators, I believe we had around a B minus. So pretty good, especially given the fact that it's sunny in Oregon, and that's not a common thing. And it's very tempting to go spend long periods of times with your friends outside, and so I think that B minus is a win. I think we can do better, obviously. I am not aware of any actual enforcement that happened over the weekend or really any need or calls. We are hearing an uptick in calls around social distancing not happening back in the grocery stores. So that's one that we've continued to see reports coming in, and we're working hard at direct outreach with some of those grocery stores. It's one thing to sort of make these broad-reaching sort of recommendations and then watching the way individual stores or locations can carry those out. But a lot of times we'll have to follow back up and make sure that people understand what really is the sort of intent behind some of those recommendations, creating that distance. It's not just about having proper signage, but really making sure that what's happening in the store is reflected by those recommendations.
Question for Dr. Ledke.
All right.
Rachel from KLCC would like to know, with more testing in Lane County, will that mean changing criteria for testing, and what is the criteria right now?
So, question from KLCC from Rachel. With more testing availability, will the criteria change for testing, and what are the criteria now? So for the State Public Health Laboratory, the testing criteria will not change. The state lab will still focus on those epidemiological testing needs. So for example, quick response to an outbreak will be in the area of the state laboratory, also to specific travel-related cases, et cetera. For the clinical laboratory, so again, Quest and LabCorp and Legacy and Interpath, and now McKenzie and Peace Health, their criteria will be set by them. It's up to them how it is that they wish to do the testing. We have recommendations from local public health and from the state on what is probably of most value, and we have shared those with those two new laboratories doing testing, McKenzie and Peace Health. And they will again focus on the critical needs. So they'll be patient-centric first, so persons who are hospitalized, persons with critical illness, and then some of the minor local epidemiological needs, such as local disease outbreaks that have already been confirmed in a facility by the state laboratory, and the state lab says, well, you already have it, there's not additional need for us to confirm it, but we locally may want to understand the depth and breadth of it better, and that testing will take place locally. So there'll be no changes with the state lab, and I think only minor changes with the commercial laboratories.
James with KORE would like to know, how encouraged should we be that the rate of positive tests in Lane County has continued to decline?
So the question is regarding the rate of positive tests in Lane County, and it has declined. You know, we were well above 3% for a time, and we've dropped down below 3%, closer to 2%. So I think that is a good sign. We clearly have not experienced a peak as experienced by persons in Italy and Seattle and New York City. We have more of a plateau. And that plateau could sit, 1, 2, 3 new cases a day for some weeks. But we have an increase in testing volume. So when you look at a fraction like that, where the numerator is stable but the denominator gets bigger because we're testing more, you have a decreased positivity rate. So I think it's heartening that it shows two pieces. It shows, first of all, there's no big increase in cases, which is good, and it also shows there is an increase in testing availability. So I'm heartened by both of those. I think those are both good signs.
All right, that's it for questions.
Very good. We're almost out.